Hi. Today I'm talking about constipation. Very common and not often treated properly. The reason being, people are worried about giving laxatives for a long time, and that's actually a myth. Laxatives can be used for a long time without any side effects because the way they work is they usually mix with the poo. They're called stool softeners. They mix with the poo, pull in water, and make the poo soft. These are called stool softeners. The second type are called stimulants, which make your gut contract and push the poo forward. So, what has happened over time is that the poo has been sitting there and the intestine has dilated. So, now when it contracts, the poo still sits in the middle and doesn't move forward. So, it will take some time for the intestine to return back to normal size. It can take weeks to months. So, the laxatives have to be used for a long time. If you stop them soon, then the intestine will go back to dilate it and it will again go back to square one. So you have to keep using either lactulose, which is a stool softener, or Movicol, which has to be taken with enough water because that's the way it works. It pulls in water and makes the poo soft. If there's not enough water, then it's not going to work. So give them morning and evening. They should be going to the toilet ideally every day, passing a soft stool without straining. Sometimes I see children who are straining a lot and going every 2 or 3 days. Not ideal. Every other day may be fine, but the stool should be soft. So use laxatives and then wean it off. When the stool is getting softer, then you can reduce the Movicol or lactulose. You might have been given something like Laxido, which is same as Movicol, or sodium picosulfate, which is a stimulant, or Senna, which is another stimulant. So these are stimulants, while Movicol, lactulose, Laxido, these are all stool softeners. So use them as long as needed. They don't get absorbed in the system and they are absolutely safe. So don't stop them. Obviously, side by side, you should increase the fiber in their diet. That means lots of fruits and vegetables. Avoid banana. Banana sometimes can constipate them. But other fruits like apple, pear, they are high in fiber. Use brown bread instead of white bread. Broccoli, spinach, and lots of berries are good for you. Prunes are good. And water. Not too much milk because milk has got no fiber and it will constipate them. So the poo should look something like this is called the Bristol stool chart. We use it very commonly. So the poo should be about type 4. 2 or 3 is not good, and if it gets runny like type 5 or 6, then we can reduce the laxatives.